So, how do you get seen quickly by a dentist if you have an emergency and need to be seen right away? Or maybe you just want to make a dental appointment to get your teeth checked and cleaned and then stay healthy. And you can call the dental office to make an appointment, and they might say that they can't see you for like 4 months. How does that help anyone? And what if you need to get some dental treatment done before a big event like a family wedding? Yeah, scheduling has gotten tougher, mainly due to a significant decrease in dental providers over the last few years. Hi, I'm Dr. Ryan, a licensed dentist in the US. I'm here on this channel providing science based information about dental care for you and your family. And today I have some tips to help you schedule an appointment at the dental office. Now, some dental practices do take walk in patients, so you wouldn't necessarily have trouble getting seen in those offices beyond just spending a lot of time in the waiting room. But what about other offices? And what about getting in for something as simple as a cleaning? Keep in mind that most dental offices work by appointments. They reserve a certain amount of time for each patient so that they can provide a standard of care to each person without making everyone wait an excessive amount of time. There are definitely some tricks that can make it easier to get in a bit quicker and at least reserve that perfect time that you want. I'll talk about three scenarios today: how to get in as quickly as possible for a true emergency, how to schedule a simple cleaning and checkup, and then how to schedule cosmetic work like teeth whitening or veneers before an event. First, let's talk about dental emergencies because this might be the most stressful situation. First and foremost, every dental office will do their best to get you in right away if you're having a true emergency. And a true emergency would include things like a toothache with swelling, or a fractured tooth, or a tooth that has been completely knocked out. What I had to share with you here are some tips on making the whole thing as easy as possible for you. First, it does help tremendously if you already have a relationship with a dental practice. If the dental practice already has your medical information and all of your personal information in their system, they can whisk you right to the back as soon as you get to the office. If you've not been to the office, you'll have to fill out all the new patient paperwork before they can see you. And this, of course, is just one more terrific reason to see a dentist for a regular checkup before a problem occurs. Another piece of advice when you're trying to schedule an emergency visit: be flexible. The dental office will try to get you in as soon as they possibly can. Let the staff person know how far away you are from the office when you call, and they'll try to work with you to see you in a timely manner. My recommendation with emergencies is to take the first appointment that the staff offers to you, especially if the tooth is fractured or completely knocked out. In regards to emergencies, I would like to be very clear about something. If you have an injury to your mouth or head due to blunt force trauma, such as from a fall or a motor vehicle accident, you should go to the emergency room first. You may think you only have a broken tooth, but it's so much more important for you to be checked for a fractured jaw or a concussion or worse. If you fall off a ladder and hit your head on the ground, you might think you're fine if you're awake and alert, but blunt force trauma to the head can be really bad. In 2009, Natasha Richardson, a Tony Award winning actress who was married to Liam Neeson, fell during a ski lesson and hit her head. She thought she was fine at first, so she declined medical attention. However, she developed an epidural hematoma, which is a brain bleed, and her condition deteriorated until she passed away 2 days later. Please, if you have head trauma, go to the emergency room first. We can fix your teeth later. So for emergencies, the best thing is to have an established relationship with a dental office, and when you call with the emergency, take the first available slot they have. One last tip: if the tooth was knocked out and you were able to find it, put it in a glass of milk and bring it with you to the dental appointment. The milk will preserve the cells on the root of the tooth, and then your dentist might be able to reimplant the tooth if they're able to see you within an hour after it was knocked out. All right, so let's talk about getting in for cleaning appointments. These are definitely about supply and demand. A dental hygienist is the person who cleans your teeth, and they need a certain amount of time in order to give each patient the best care possible. This means there are only so many patients they can see in a day. The most popular appointment times will be the toughest ones to get. These popular times are typically the very first appointment in the morning and then the last one at the end of the day. Most people want those appointments so they can either be seen on their way to work in the morning or on the way home in the evening. The next group of popular appointments, at least for our area, are those that fall on school holidays. Kids and teachers are out of school those days, and so they'll be very popular for those two groups of people. We're talking teacher work days, spring break, summertime as well. Holidays are also very popular for these groups and for everyone else who's off of work. Finally, the entire month of December is really popular, not only because people are out of school and off of work, but many people are just trying to use up any remaining dental insurance benefits before the end of the calendar year. So how do you get an appointment during these really busy times? Honestly, you need to plan ahead. This seems obvious, I know, and I'm not trying to be pedantic. I'm just shooting you straight. If you are going to want a popular time of day or a popular day in general, you'll need to schedule that as far in advance as you can. One great tip is to go ahead and schedule your next cleaning as you're checking out from a cleaning. And as soon as you get that school calendar, be sure to look ahead and see which days work best for you and your family. If you're more flexible than that, you can try to schedule during one of the less popular times, like late morning or early afternoon, when more appointments might be available. Also, ask your dental office which times of year are usually a little slower for them. For us, we're usually slower in February and then in September. That's because in February, people are still paying off their bills from the holidays. And then in September, many families are just getting back into their full schedule of school, as well as the kids' activities and all that. So the dental office isn't often at the top of their priority list in September. The other tip is to ask your dental office if they have a call list. We send our text reminders to our patients before their appointments, and sometimes people realize they have a work or life conflict with the appointment, and then they have to reschedule. If your dental office keeps you on a list, they can contact you when someone else moves their appointment. And then if your dental office uses a call list to do this, let the scheduler know that what day of the week works really well for you or what time of day works well. And the next time they have that opening, they'll give you a ring. Finally, what if you want to get dental work done before a deadline? Maybe you want to get in before the end of the year, before your insurance runs out, or maybe you're trying to get some teeth whitening or cosmetic work done before an event like a wedding or a high school reunion. Well, many times patients want to get dental work done before the end of the year, like I said, in order to maximize their insurance benefits. There are a few tricky things here to keep in mind. As I mentioned, December is already busy, so getting an appointment does require some planning, and it is best not to wait until the last minute to try to start a project. If you're trying to get work done which requires more than one visit, like a crown, a bridge, veneers, or a denture, if you're trying to complete something like that before the end of the year, you will probably want to get it started in November. That way it'll give you time to get it completed by the end of the calendar year. Because here's one other thing. Sometimes the insurance company won't pay for a crown or bridge until it is cemented in place. Not all the time, but sometimes if you start a crown or bridge in December and it gets cemented in January, it may not get processed with the previous year's benefits, but instead with the new year's benefits. You got to check on the wording in your paperwork to be sure. Even if you're not trying to maximize insurance benefits, if you wait until too late in December to get restorative work done, you could be in temporaries over the holidays, which is not fun. So don't wait too late to schedule that work. Of course, if you're trying to get dental work done prior to a wedding or a class reunion, and that work will require a few visits. So keep in mind that timing could be tricky. Getting veneers or even whitening your teeth can take a little bit longer than you might expect, depending on your situation. So be sure to give yourself and your doctor plenty of time to get your work done. I feel like we covered that pretty well. If you have some scheduling hacks that maybe I didn't mention, put them in the comments below. Thanks for watching this long. I appreciate the support. To get the story on why dentists haven't used Novocaine since the 50s, check out this video. And if you haven't already, please subscribe so you can stay up to date on oral health information. And remember, smiles are contagious.